Hey guys, thanks for joining me for a little bit of informal training on the plan of care. I've had several physical therapists over the last few years ask me on how to go about creating a really solid plan of care where the patient has strong confidence in what we're leading and directing. And when we do this, it has a much better impact on our outcomes. And so I think this is super important. So I wanted to start off by just talking about a couple of the pitfalls that we have as physical therapists sometimes in the creation of the plan of care with a new patient. We do an awesome job with our evaluations, and I think there's times where we do a pretty good job in explaining the pathology to the patient. But somewhere in the translation of this is your problem, and I can help with through physical therapy, we don't always translate that what we're going to do and give them strong confidence and understanding in that. If we do take that step, sometimes we drop the ball with not displaying or conveying to the patient what it's going to take to get there. So this can be done in a very concise way, and I wanted to review that a little bit today. First and foremost, if we go to our whiteboard, well, let me back up in that. Just yesterday, I heard a therapist in our office that was talking to their patient. The patient walked out and said, "Hey, okay, I know what I've got with my shoulder problem here. What do you want me to do?" And the therapist said, "Well, I think this is going to take probably 6 or 8 weeks or so to get better. And what I want you to do is go to the front desk and schedule." And the patient said, "Okay, how often do you want me to schedule?" And the therapist said, "Well, 2 or 3 times a week." And the therapist and the patient just had this kind of blank stare for a minute and said, 2 or 3? Well, what's best? And the therapist said, "Well, whatever works for your schedule." Now, really that undermines the confidence of the patient completely. And let's review that together. What I've got here on the whiteboard is a few little diagrams here of what the patient needs. Patient really needs confidence and an understanding of the pathology, an understanding of the plan, including dosing, frequency, and time. What is the time? The time it's going to take to get better. If I've got a shoulder problem, and as a physical therapist, I know it takes generally 6 weeks to recover from this, I need to tell them 6 weeks. If I know we've got some comorbidities, I've got a little bit of diabetes, whatever I've got, they're a smoker, and I'm predicting that it's going to take 3 or 4 more, I need to be honest with that and tell them why. Then really, in that whole dosing, 2 or 3, let's be honest, they look at this, as they should, as a type of medication to their scenario, but it's a physical medicine medication. So if they're coming in 2 times a week, and that's what I think is necessary to get them better, I better have a pathology reason that makes sense. For instance, if I have a patient that has full strength and range of motion is pretty good, then perhaps 2 times a week is pretty good, is pretty accurate. I used to do that all the time, 2 times a week with our gym rats over at Gold's Gym. They would come in for A-stem or dry needling, something very specific. Did they need any strengthening? Maybe some eccentrics, and I could give them direction. But more often, I was telling them what not to do. That was probably fairly appropriate for the physical therapy that they needed in order to overcome their pathology problems. Most of our patients, though, a great majority of them, have strength issues, weakness. And I just have to review quickly, whether it be research-based from muscle pathology, muscle strengthening, really, who goes into the gym once a week and expects improvement, or even twice a week? Never. In fact, the consistency of what we need is at 3 times a week for any amount of strengthening. In fact, I do 4. I do 3 to 4 times a week. I think there's much more literature and scientific background or basis for that than 1 to 2 times a week ever. Honestly, we got to be able to talk to them about their home exercises and know that they're going to do those. Yet if I give them more than 2 to 3 home exercises, they're actually not going to be compliant. The research really backs that. So be careful in what you do with the home exercises, how many you give them. But also be careful to rely on that and say, I can have them come 1 to 2 times a week and they're going to get better because of their home exercises. Statistically, you and the patient are going to lose. Your outcomes are going to stink. and really the patient satisfaction is going to be poor. So let's go back to this again. Dosing, frequency, and time. When we look at dosing, frequency, and time for a patient, look at the pathology. Honestly, 3 times a week is what is going to get them better the fastest. And we have to be aware of something that I would like to call really a treatment fatigue. In our lives, we're busy, so are our patients. And if we just continue to draw treatment on and on and on for months, they may not accomplish their goals because of early dropout. That is a chronic problem in our whole profession across the United States. So be careful not to draw it out at 1 to 2 times a week forever and expect to get the results that the patient needs. Again, I'm a high proponent of 3 times a week. If they do mess up and have to cancel an appointment, they still had 2. But with 2 times a week, if that happens to them, they have had 1. And the success of the building and strengthening, as well as range of motion, any other goals that we tend to have to try to help them optimize their success and reach their goals, you might as well just scratch off a whole week out of their progress. Don't do it. Be there and give them reinforcement. Now, there's times in which 2 times a week is appropriate, but be very careful that you understand why you're doing what you're doing and do it very purposefully. Now, there's some really good techniques to help arrange the plan of care as we go and interact with them. Often we get excuses. I can't come that much. I can't spend this amount of time. I can't pay my copay, whatever I've got. But really, be very specific, first and foremost, about that plan of care. Telling them this should get better in 8 to 12 weeks, that sounds like you have no clue what you're doing. Please be specific. Let them know that not all people are the same, so there's some latitude, but be specific. Be a professional. Second is, don't lie. Don't tell them that there's no difference between 2 times a week and 3 times a week. Certainly don't lie and tell them that you can get them better if it normally takes 3 times a week for 6 weeks to heal a tendinopathy. Don't tell them that you can get them better in 1 to 2 times a week in 6 weeks. If they need to adjust and you need to negotiate their plan of care, help them recognize that it is my professional opinion that if you're going to decrease the frequency of which we are seeing you on a weekly basis, not only will you have to be so much more compliant with your home exercises, but I'm going to have to increase the time it takes to get you better. And I need to be specific about that response at the time of my evaluation. Therefore, if a patient comes to me and says, Bart, I know you want me to come in 3 times a week, but I really can't come in 3 times a week because of work, because of other obligations, whatever. So I go ahead and tell them, well, I was going to set you up for Monday, Wednesday, Friday for the next 6 weeks to resolve this issue and help you reach your goals and the reason that you're coming in here in the first place. But because you can only come 2 times a week, now I'm going to extend that a full month. You're missing 1 dose per week of physical therapy treatment. And so I'm going to go ahead and extend that an extra 4 weeks on the backside. Why do I do that? Honestly, because that's what my professional opinion is that when you decrease the frequency of the intervention or the dosing of the therapy, the rate of progression slows. So I'm going to need that on the backside. So when you talk to them about this, I use the phrase often, look, I can't lie to you. Because you can only come in 2 times a week, even though I'm recommending 3, that means that I need to extend your plan 1 full month, which is going to take you longer to get better and perhaps more money. Because if you do the math, it will. Now, if they still need to do that, you need to be able to help them along the way, but help them with understanding and truth. Don't lie. Don't tell them that you can get done something in a less amount of time that you know from your professional opinion can't happen. The last thing is really to own it. We need to own the plan of care. We've written down a plan of care agreement for each patient. That's required in order to help them understand. They take that home. They've got pictures of their team on the backside of that paper. Hopefully it goes on the fridge along with their appointments. But when we own the plan of care, really what that means is helping them be accountable to themselves and to us in the process. Often, we're a coach. That's what we need to be. And accountability is huge. So don't let it slide. Often when I'm setting up a plan of care and the patient is nervous a little bit, it might be the copay. It might be, how do I know when I'm done? What if I'm done early? What if I'm not improving? What if this doesn't get me better? There's a lot of what ifs, right? But I confidently look at them and say, hey, look, I know that it's going to take us predictably 8 weeks to improve this problem that you have with your shoulder. So what I'm going to tell you is if at 5 weeks or at 6 weeks, if we haven't made 50% improvement, we need to stop therapy. You and I need to do an assessment, and we're going to put it on the schedule at 6 weeks, and we're going to reassess where you have, what you have improved in your plan of care. And if you haven't had that 50% improvement, we better stop. We better get you back to the doctor. We better get you to a specialist. We might even need to entertain surgical intervention or other types of injection, something more invasive. Look, you got to stand with your plan of care. You got to predict if people are going to get better, and you got to tell them the truth. So just a few techniques. If you're struggling to get that full plan of care scheduled, you're going to struggle with your patient outcomes. If you're struggling with those things, your patients just aren't going to believe you, and you are the professional. So own it. Thanks, guys.